Joining me now is Dr. Lisa Salamon. She's a family and ER doctor. Good morning. Good to see you, doctor.
Good morning. Nice to see you too. Thank
Describe for
you.
us what's been happening these past few weeks in your ER as we are really in the thick of respiratory season.
Yeah, I mean, our emergency departments are extremely busy. Our volumes have increased dramatically, especially over the holidays. But what people need to know is a lot of people are coming in really sick. They need to come to the emergency department. We have problems because patients are admitted in the hospital. We're short on inpatient beds. And so what ends up happening is that the patients who are sick and require admission end up staying in the emergency department, often for days. And what that leads to is then patients in the hallways and longer waits. And that really is the root cause of what we're seeing when we talk about emergency overcrowding.
How long would you say someone is waiting to be seen by a doctor right now at your ER? I've heard stories of 15 hours or more.
Okay, so I mean, the places that I work, it's we actually do a really good job. We work very hard, and we have come up with all sorts of different processes and innovative design. So, the patients who come to the emergency departments that I work at often are being seen. We really try within 2.5 hours. Obviously, people who are much sicker get seen right away. That being said, there are many hospitals across GTA, across the province, across the country, where I'm hearing that patients are waiting 4, 5, 6 hours. And the other thing that we don't have the data for that's really important is the times that are published that we're hearing about, which are physician initial assessments. That's the time from when the patient sees the triage nurse to when the doctor sees them. That doesn't account for the time when patient walks into the emergency department and is waiting to see a triage nurse. And for some places, and we hear this anecdotally from patients, they may wait a couple hours until the nurse even assesses them. So I think the waits are even longer than the data that we're seeing.
So, Doctor, the CMA has put forward a number of recommendations. I'm wondering if during your time you have seen things devolve compared to when you first started practicing medicine. What's it like now, and what do you think is the difference?
We always talked about hallway medicine. And I remember when the Ford government in Ontario came in, they said their mandate was to end hallway medicine. And then through the pandemic, basically now it went from hallway medicine to waiting room medicine. And so we're seeing so many patients in the waiting room. I said this, I think in 2022, our health system has collapsed, and it's only getting worse, and it really is collapsing all over the place. And I think from the emergency department point of view, the issue is really, been talking about this for years, and it's just getting worse and worse and worse, is the issue and the lack of long-term care beds, the issue and lack of enough home care. So patients are staying in hospital longer, where there are better places for them to be, more appropriate places for them, and places that they would rather be. I mean, patients want to be discharged home if they can, with the support that they need. And many patients could be at home if they had the proper home care. Of course, there's some patients who the best place for them is in long-term care. And often these patients end up staying in hospital for weeks or months, waiting for the appropriate level of care. So we've talked about this for years, but it's just getting worse and worse and worse. And we really need a pan-Canada meeting with all the health ministers, including organizations like CAPE, which is a Canadian Association of Emergency Physicians as well, because we do have solutions in terms of the actual problem with emergency departments.
Dr. Solomon, thank you so much for taking the time to speak with us today. We really appreciate it.
Thanks for having me.